Liver function test. Based on functional capabilities of the organs, specific biochemical investigations are used to assess their functions. And all these tests are based upon the functions performed by liver. First, we can see the functions performed by liver. The prime function that is performed by liver is its metabolic functions. That is, liver take part in carbohydrate, lipid, protein, mineral and vitamin metabolisms. Next major function is excretory functions. That is, it is involved in the excretion of bile pigments, bile salts, cholesterol. And next prime function is its protective function and detoxification. We all know detoxification is the conversion of toxic compounds to less toxic and more easily excretable form. That is done by liver. And liver also perform phagocytosis to eliminate foreign compounds. Ammonia is detoxified to urea. That is also an important example. Next, about its hematological functions. Liver participates in the formation of blood, synthesis of plasma proteins and destruction of RBCs. Next major function is storage function. The main important compounds such as glycogen, vitamins A, D and B12 and trace element iron are stored in liver cells. Next, about its synthetic functions. Liver involves in the synthesis of major proteins such as plasma proteins, albumin, alpha and beta globulins and clotting factors, then carrier proteins, different hormonal factors, growth factors, bile acids, cholesterol and phospholipids. Next, we can see the important hepatic function and their associated plasma or serum markers. In heme metabolism, so what about its plasma or serum markers is the serum bilirubin increases. And about the enzymes, you can see the increased activity of alkaline alanine transaminase, aspartate transaminase, gamma glutamyl transferase. And related with protein synthesis, the albumin concentration decreases in plasma, whereas increased prothrombin time also can be noticed. In protein catabolism, urea level increases and also ammonia concentration increases. In lipid metabolism, increased concentration of plasma cholesterol and triglycerides. And related with drug metabolism, increased half-lives of drugs can be noticed. In bile acid metabolism, the bile acid concentration increases. So next we can see different tests, that is liver function test based upon its functions. First one, measurement of bilirubin. That is, this is the test based on excretory function of liver. And we know bilirubin, that is the excretory end product of heme degradation, and it is conjugated in liver and excreted in bile. And we all know about the normal range of this bilirubin, that is total bilirubin is 0.2 to 1 milligram per dl, conjugated bilirubin 0.2 to 0.4 milligram per dl, whereas the unconjugated bilirubin is 0.2 to 0.6 milligram per dl. And total bilirubin is the sum of conjugated and unconjugated bilirubin. And related to this bilirubin estimation, we should know the one term, that is icterus index. It is a test used to measure the yellow color of serum due to bilirubin. And the normal icterus index value ranges from 4 to 6. Greater than 6 indicates hyperbilirubinemia. Next, about the important reaction related with this bilirubin estimation, that is Vandenberg reaction. It's a specific reaction to identify the increase in serum bilirubin. And the normal serum gives a negative Vandenberg reaction. And for this test, we are using one special reagent that is known as Vandenberg reagent. And it is a mixture of equal volume of sulfonylic acid in dilute HCl and sodium nitrite. And if you are mixing this reagent with serum bilirubin, that is, or serum containing bilirubin, it forms one azobilirubin which is purple in color. And during this Vandenberg test, 3 types of responses may be noticed. First one is direct positive Vandenberg reaction. In this reaction, if the serum is having conjugated bilirubin, when we are mixing with this reagent, it shows the purple color formation immediately within 30 seconds. That indicates it is a direct positive Vandenberg reaction response. And if the serum is having unconjugated bilirubin, when treated with this reagent, if the purple color formation is taking place after the addition of methanol, then this reaction or response is indirect positive. Third one is, if the serum is having both conjugated and unconjugated bilirubin, when treated with this reagent, immediate purple color formation takes place and the color intensifies with the addition of methanol. It shows biphasic response. So these are the three different types of response. First one direct positive, second one indirect positive, third one biphasic. And next we can see the clinical significance of serum bilirubin estimation. Serum bilirubin estimation is useful in understanding the nature of jaundice. We know the types of jaundice. So classification of jaundice is hemolytic or prehepatic jaundice. In this type, unconjugated bilirubin increases in serum. Second one, hepatocellular or hepatic jaundice. In this type, both conjugated and unconjugated bilirubin increases. Third one, obstructive or hepatic jaundice. Here, conjugated bilirubin increases in the serum. And this slide shows the urinary findings in jaundice. So in prehepatic or hemolytic jaundice, the bile pigment is nil, bile salt is nil, and urobilinogen is present. So 2+ is shown. Hepatocellular jaundice, bile pigment 2+, bile salt is present, that is 1+, urobilinogen normal or reduced. In post-hepatic jaundice, bile pigment 3+ is there, bile salt is 2+, and urobilinogen nil or reduced. And conjugated bilirubin being water soluble, it is excreted through urine, whereas the unconjugated bilirubin is insoluble in water. And the biochemical test used to find out the presence of bilirubin in urine is Faucher's test, and the bile salts in urine we are using Hayes test. Next test is about test based on excretory function, that is bromosulfathalin test. And we should know about the bromosulfathalin. It's a non-toxic compound and exclusively excreted by liver. So this BSP is administered intravenously at the dose 5 mg per kilogram body weight. And serum concentration of this BSP is measured at 45 minutes and at 2 hours. For a normal healthy individual, less than 5% of this dye is retained at the end of 45 minutes. Any impairment in liver function causes increased retention of this bromosulfathalin dye. So it's a very sensitive test to assess the liver abnormality. Third one, the test based on synthetic functions of liver. First one, serum albumin level. All plasma protein except the immunoglobulins are synthesized by liver. So albumin is the most abundant protein synthesized and reflects the extent of functions of liver cell mass. In liver damage, albumin level decreases. Second one, globulins. In chronic liver diseases, gamma globulin increases. Third one, prothrombin time. Prothrombin is synthesized in liver and it is a useful indicator of liver function also. The half-life of prothrombin is 6 hours. Prothrombin time indicates the present functioning of liver. Prolonged prothrombin time shows liver loses more than 80% of its reserve capacity also. In vitamin K deficiency, prothrombin time increases, and liver disease also prothrombin time increases. Next test is based on serum enzymes, that is liver enzyme panel. So among the major enzymes, first one is transaminases or aminotransferases. Next one is alkaline phosphatase. Next one, gamma glutamyl transferase. First we can see the transaminases or aminotransferases. So that is, what is the principle behind this test based on serum enzymes? In liver damage, several enzymes are released into circulation. Measurement of these enzymes are used to assess the liver function. So what about transaminases? Two main transaminases are there, ALT and AST. So both are widely used to assess the liver function. ALT is a cytoplasmic enzyme and its normal range is 5 to 40 IU per liter. AST is both cytoplasmic and mitochondrial and its normal range is 5 to 45 IU per liter. Both ALT and AST increases during liver damage, but ALT is more sensitive and reliable for the assessment of LFT than AST. And about the alkaline phosphatase, it's an enzyme derived from bone and liver. Increased ALP activity is an indicator of obstructive or post-hepatic jaundice and its normal range is 3 to 13 Ka units per dl. And also occurs in liver and hepatic tumors also. Next about the gamma glutamyl transferase. and it's a microsomal enzymes and it's a sensitive index to detect the alcohol abuse also. Its normal range is 5 to 40 IU per liter. Highly elevated in biliary obstruction and alcoholism. Next one, test to assess the metabolic capacity. Among this, the main one is galactose tolerance test. Here, galactose, we know galactose is the carbohydrate. It is exclusively metabolized by liver. Liver function is assessed by measuring the utilization of galactose by the body. So, the subject is given an IV administration of galactose at the dose 300 mg per kilogram body weight. Blood is drawn at 10-minute intervals for the next 2 hours and galactose is estimated. In the normal individuals, half-life of galactose is about 10 to 15 minutes. The value elevated in hepatocellular damage, especially during infective hepatitis and also cirrhosis. Next one, test based on detoxification function. For this we are using hippuric acid test. When benzoic acid combines with glycine, hippuric acid is synthesized in liver. So 6 gram sodium benzoate is orally given to the subject after light breakfast and after emptying bladder. Urine samples are collected for next 4 hours and the amount of hippuric acid excreted is estimated. 6 grams sodium benzoate yields 7.5 grams of hippuric acid. A healthy person can excrete 60% of sodium benzoate and excreted in urine. So reduction in hippuric acid excretion indicates the hepatic damage. Thank you. Thank you one and all.